We decided to study the psychology of music, specifically music therapy.
Psychology of music is simply a branch of psychology mainly used to explain and understand musical behavior and experience.
It is also important for music performance, composition, education, medicine, and music therapy.
Music has been associated back to Hippocrates and Aristotle, who used music to purify emotions. Music has also been used to treat patients in ancient Arab hospitals and Native American tribes by their medicine men.
Music therapy is used throughout a variety of ages. It is used for children in two main ways, in one-on-one sessions or in group settings.
Music therapy can help therapists by getting higher communication and attention from a child. Children in group sessions are often provided with high quality and colorful instruments that are adapted to them, while the therapist will play guitar or piano to keep the rhythm grounded.
Music therapy is also common with adolescents who have mood disorders. Teenagers already associate with music. In fact, they make up 70% of pop music sales.
Therefore, they turn to music with self-identity, and it serves as a creative outlet. Music can reduce stress by creating one's mood, which lowers depression levels.
Music is often used with elderly people in conjunction with traditional therapy to help the speed of stroke therapy. Findings from music therapy used in accordance with stroke therapy show that the music causes more positive emotional effects than just the stroke therapy alone.
It also improves the rate of recovery and emotional and social deficits resulting from stroke. The Mozart effect is a theory based on research that suggests that listening to Mozart's Piano Sonata K448 can reduce the number of seizures in people with epilepsy.
Music therapy is also used to treat PTSD or post-traumatic stress disorder. Music therapy arouses many forgotten memories, which help heal these veterans.
There is no consensus yet in the medical community whether or not musical therapy works. Opponents of the treatment argue that the music's healing power has no scientific backing and that there's no clear link between music and brain's activity.
But recent findings from McGill's neuropsychology department suggest that specific parts of the brain are activated when patients listen to music which they like. When reward and motivation systems are jazzed up, they start to feel better. Same as eating good food, doing drugs, being in love, or having sex. Arouses many forgotten memories, and music is an associative portion of the brain.
So how does music affect the mind and body? First of all, music enters the brain through more than just one area. It starts by reducing cortisol levels, a chemical in the brain which first causes the stress. Music also has the potential to shift states of consciousness. It can change a person's perception of time, from virtual time to experimental time, from left brain to memory. Music can also activate the flow between the left and the right brain. It can activate the flow of memory across the corpus callosum, which allows the left and right hemispheres to work in harmony instead of conflict.
Music stimulates the production of alpha and theta waves in the brain. Highly creative people have a different pattern of brain waves than just normal non-creative people. Bursts of alpha waves induce creativity, while theta waves are associated with dreams. Listening to music affects the autonomic nervous system by calming heart rate, breathing, and lowering blood pressure. Strong beats stimulate brainwaves to resonate in sync with the beat.
Faster beats create a sharper concentration and more alert thinking, while a slower beat causes a calmer, more meditative state.
It also creates a positive state of mind by decreasing anxiety and depression, increasing creativity, and keeping stress from ruining the body.
Notable practitioners include Juliette Alvan, born in 1897, who was a British music therapist and founded the Society for Musical Therapy and Remedial Music in the 50s. Helen Bonney, born in 1921, who developed the GIM, or Guided Imagery in Music, and Dr. Concetta Tomeno, a pioneer in the field for individuals suffering from brain trauma and stroke.
Thank you for listening to our presentation. Now we will move on to a quiz. I hope you have enjoyed and learned something from this experience.